Hello everyone. In this video we are going to discuss about typical ribs. So 3rd to 9th ribs are typical ribs as they are sharing common features, and here I have got a typical rib. So let's see the features of a typical rib. Now each rib is having two ends, posterior end and anterior end, and intervening shaft. The shaft is having two borders, upper and lower, plus two surfaces, outer and inner. Now let's see first the posterior end. So this is the posterior end. It includes a head, a constricted neck and a tubercle. Now how to identify the head? It is having articular facets, two articular facets. The upper one is smaller and lower one is larger, and in between these two there is a sharp bony ridge which is termed as crest. So this is the head which is articular, and that will articulate with the body of vertebrae. Now let me show you how it articulates. So these are thoracic vertebrae, and on either side of the body you can see there are costal facets over here. Now this will articulate with the corresponding articular facets found along the head. So as I told you, the head is having two articular facets. The smaller one is upper and larger one is lower. So the upper smaller one will articulate with a vertebra above, and the lower larger one will articulate with the numerically corresponding vertebrae like this. This is how these are connected. See this. And this will form costovertebral joint, which is plain synovial like this. So this is how the articulation will take place. The crest, which is found between the articular facet, it is related to the intervertebral disc in between these two vertebrae like this. Okay. So this is how the articulation will take place. Now the head in front provides attachment to triradiate ligaments with three bands, upper, middle and lower. The lower band is connected to the numerically corresponding vertebrae on either side along the body. The upper band is attached to the one vertebra above, and the middle band is attached to the intervertebral disc, and that is also termed as intra-articular ligament, which divides the joint cavity of costovertebral joint into upper and lower compartment. Now the articular surface around the over here, as we have discussed, upper and lower articular surfaces that will provide attachment to joint capsule all around, and the crest provides attachment to this intra-articular ligament, which is nothing but the middle band of triradiate ligament. Now in lower ribs, this anterior aspect of the head is related to sympathetic trunk. So this is regarding head. So now you know the head articulates with two vertebrae, one above and one at the same level. Now this is termed as cephalic migration of the head. Now this starts at 2 years of age and this completes at 6 years. Now during that period, due to this cephalic migration, this posterior end will assume slightly higher position as compared to the anterior end, and that will attribute the obliquity of the rib, and that will help in respiratory movements. So to attain the obliquity, the cephalic migration of the posterior end occurs. Now when you see a rib from behind, next to the head you will find a tubercle. So the area between head and the tubercle is the neck. So this is the neck, and when you connect it with the vertebra again like this, and when you see it from above, so the neck is found in front of transverse process of numerically corresponding vertebra, and it is directed backward and laterally. So this is the neck, this is how it is related to the transverse process, and the neck itself is having two borders, upper and lower border, plus two surfaces, anterior and posterior surface. Now first is the anterior surface. It is subdivided by a faint ridge into upper small area and lower large area. The faint ridge laterally continues with inner lip of the upper border. The upper border is having outer lip and inner lip. So this faint ridge laterally is continuous with the inner lip of upper border. The ridge itself is providing attachment to posterior intercostal membrane, and the area above to the ridge, the smaller area, is related to fibrofatty tissue. So there is a fibrofatty tissue, and then there is a posterior intercostal membrane which belongs to the upper intercostal space, and the lower larger area, it is related to endothoracic fascia and costal pleura. So this is about anterior surface. Now next is the posterior surface. It is rough, and this is related to anterior surface of the transverse process, that is what we have seen, and in between these two there lies costotransverse ligaments. So when we connect it again with the vertebra and its transverse process, so here is the posterior surface of the neck, and that is connected with particularly with inferior costotransverse ligament. Now the upper border, it is sharp and it is also termed as crest or crista colli, and that provides attachment to superior costotransverse ligament, whereas the lower border is continuous laterally with the upper border of costal groove. See, this is a costal groove which is found along the lower border of the shaft, and it is having upper and lower lip. So laterally this lower border of the neck is continuous with the upper lip of costal groove, and itself it is providing attachment to posterior intercostal membrane of lower space. So basically posterior intercostal membrane extends from lower border of the neck of upper rib to the faint ridge along the anterior surface. So over here lies the posterior intercostal membrane of lower space, whereas the faint ridge provides attachment to posterior intercostal membrane of upper space. Now next to the neck along the posterior aspect, there is a tubercle. It is subdivided into medial articular part and lateral non-articular part. So this entire thing is the tubercle, which is situated at the junction of neck with the shaft, and this is the articular area which is showing circular to oval articular facet, which is directed backward and medially in case of upper 6 rib, and in lower rib it is directed downward, backward and medially, particularly from 8 to 10 ribs. Now this articular facet will connect with corresponding articular facet found along the anterior aspect of transverse process of numerically corresponding vertebra. So here you can see this is a thoracic vertebra, this is body, this is transverse process, okay, this is spine, and along the anterior surface of transverse process you can see a corresponding articular facet. So here connects the articular area of the tubercle, and these two together will form costotransverse joint, which is again plain synovial. So this is how these two are connected. Now this articular surface, particularly in upper 6 rib, it is convex, and as I mentioned it is directed backward and medially. So there is a reciprocal concave articular facet along the anterior aspect of the transverse process, here in this case you can see, and so as the articular facet is concave convex, it will permit rotatory movement in upper 6 ribs, whereas in case of lower ribs, particularly 8 to 10 ribs, as we have discussed, it is directed downward, backward and medially, and it is almost flat here in this case, and so as the articular surface along the transverse process is also flat, and in lower ribs, particularly 8 to 10 rib, the movement is like gliding. So in upper 6 rib along the costotransverse joint, the movement is rotatory, whereas in lower ribs, particularly 8 to 10 ribs, the movement provided along this joint is gliding. So this is a basic difference between the costotransverse joints of upper ribs and lower ribs. Now this lateral non-articular area, it is rough and it provides attachment to lateral costotransverse ligament, which extends from tip of the transverse process. Over here you can see tip of the transverse process to the non-articular rough area. So here there is lateral costotransverse ligament. So between the rib and the vertebra, there are total 3 costotransverse ligament, superior, inferior and lateral. Let's understand attachment of this ligament in a diagram. So in this diagram you can see this is a superior view of thoracic vertebra, okay, like this it is oriented. So this is a transverse process, this is body, and along with the transverse process the rib is connected, and this will be the head, this is the neck, and this is the tubercle with articular and non-articular areas. So here will be the superior border of the neck, which is termed as crest, and as we have discussed, it provides attachment to superior costotransverse ligament, which is connected to inferior surface of a vertebra above. Okay, so this is a numerically corresponding vertebra. So a vertebra which is connected above along its transverse process, along its inferior surface, this superior costotransverse ligament is connected. Now posterior surface of the neck is connected to the inferior costotransverse ligament, here you can see, and that is connected to the anterior aspect of transverse process of corresponding vertebra. And third costotransverse ligament is lateral costotransverse ligament, which is connected to tip of the transverse process of the corresponding vertebra to the non-articular area of the tubercle. So this is how superior, inferior and lateral costotransverse ligaments are attached. So this is regarding posterior end, which includes head, neck and tubercle. Now next is the anterior end. As you can see over here, it is having a depressed area. Now this will connect with corresponding costal cartilage to form costochondral joint, which is primary cartilaginous joint. So you can easily identify anterior end and posterior end. The posterior end is having head, neck and tubercle, and head is having articular areas, whereas the anterior end is depressed to accommodate costal cartilage. Now next is a shaft. It is flat, it is curved, it is twisted and it is angulated. So for a typical rib, you'll have to remember a mnemonic like CAT, curved, angulated and twisted. And initially beyond the tubercle, this is a tubercle, so initially beyond the tubercle it is directed backward and laterally when you see it from above, okay, and then at a particular point it abruptly twists, it turns, and then when you see it from side the shaft is directed downward, forward and then forward, downward and medially. So this is how it is oriented. Now this twisting is termed as posterior angle of the rib. It is a weakest point, vulnerable for fracture. Now similar kind of twisting is observed few centimeter lateral to this anterior end, somewhere over here. So this is termed as anterior angle. You can see it from above, you can appreciate. So this is the anterior angle and this is the posterior angle. Now the shaft itself is having two borders, upper border and lower border, plus two surface, outer surface which is convex outside and inner surface it is concave. So let's see first the outer surface. So when you see it beyond the tubercle up to the angle, you can see a rough area which is seen in the form of an rough oblique ridge. Now the space between these two from tubercle to the angle, it increases from 2nd to 10th rib and it reaches approximately 5 cm at the 10th rib. Now this oblique ridge into this space provides attachment to posterior layer of thoracolumbar fascia and iliocostalis thoracis, whereas near the anterior angle you will find another faint ridge, faint oblique ridge. Now this will separate external oblique abdominis in front to the serratus anterior behind, particularly in upper 8 ribs. Rest of the surface, external surface is smooth and it is convex and it is forming the thoracic wall. Now next is the inner surface. Again it is smooth, it is concave and it is limited by upper and lower border, particularly along the lower border posteriorly there is a costal groove, you can appreciate it. Now this costal groove, it is having two lips, upper lip and lower lip. Now the lower lip itself is nothing but the lower border. So you can say that within the inner surface there is a costal groove which is obvious in posterior part only, and then it becomes faint along the anterior aspect. Now this is having two lips, upper lip, lower lip and floor. Now the upper lip is continuation of lower border of the neck, that is what we have discussed, and the upper lip provides attachment to intercostalis intimis muscle, whereas the floor provides attachment to internal intercostal muscle, whereas the lower border provides attachment to external intercostal muscle. Okay, now the inner surface itself, it is related to endothoracic fascia and costal pleura. Now next is the upper border. It is having two lips, outer lip and inner lip. You can appreciate over here, two lips, inner lip and outer lip. The outer lip provides attachment to external intercostal muscle, whereas the inner lip provides conjoint attachment of internal intercostal and intercostalis intimus muscle. So two muscles are attached to the inner lip and one muscle is attached to the outer lip. Regarding neurovascular plane, as we have discussed, the upper lip of the costal groove provides attachment to intercostalis intimus muscle, whereas the floor provides attachment to internal intercostal muscle. So between these two muscles there is a neurovascular plane, and that is having a neurovascular bundle in the form of intercostal vein, intercostal artery and intercostal nerve. Now these three structures are related from above downward respectively. So first comes the vein, then artery, then nerve. Now these features are found in typical intercostal space. Let's just see similar thing in a diagram. So here you can see these are the ribs and the intercostal spaces in between. So as we have discussed, the lower border will provide attachment to external intercostal, and that will go down to attach to the outer lip of the upper border. So here is the external intercostal muscle, and the direction of muscle is downward, forward and medially like this. So if it is anterior, if it is posterior, then the muscles are directed downward, forward and medially. Now next to it will be the internal intercostal muscle, and the fibers are oriented right angle to the direction of fibers of external intercostal. So the internal intercostal fibers are directed upward, forward and medially, just right angle to the direction of fibers of the external intercostal. So this is how they are directed, upward, forward and medially, and they are connected above to the floor of the costal groove and below to the inner lip of the upper border. Similarly, deep to it will be the intercostalis intimus, and as we have discussed, there is a neurovascular plane between these two muscles, and vein, artery and nerve. This is how you can remember a mnemonic VAN for intercostal vein, artery and nerve. They are situated from above downward in costal groove. So whenever we need to do pleural tapping, a needle should be nearer to the upper border of the rib, okay, so as to avoid injury to this neurovascular bundle. Regarding site determination, now we know there are two ends, posterior and anterior end. So anterior end is having a depression, so this is anterior end, this is posterior end with a tubercle, and the shaft is having costal groove along the lower border. So this should be the lower border, okay, this should be the upper border, and the convexity should be outward. So this is left rib. Similarly, when you see another rib, see over here, this is posterior end, this is anterior end, and here you can see the costal groove along the lower border. This is the convexity facing outward, so this is right rib. One more thing about the typical rib is, as we have discussed, it is having curvature, angulation and twisting. So these three things will make the shaft in such a way that both the ends of the rib will not touch the flat surface simultaneously. Here you can see over here, because of the twisting and angulation, either of the angle will remain up from the surface. See over here, if I try to put it like this, okay, see, one end will remain up. So in any condition, both the ends will not touch the flat surface. See this. Now, regarding anatomical position, as we have discussed, because of cephalic migration, the posterior end will remain slightly up as compared to the anterior end, and the shaft beyond the angle is directed downward forward, and then downward forward and medially like this, okay. Plus the posterior end will be slightly nearer to the midline as compared to the anterior end. So this is how you should hold it in anatomical position. Again, when you see it from above, the initial shaft should direct backward and laterally. So this is how you should hold it in anatomical position. This is posterior end, this is anterior end, and here if you imagine a sagittal plane, so the posterior end should be nearer to the midline as compared to the anterior end. The initial shaft should be backward and laterally, okay. Now this is the orientation of the remaining shaft. It should be slanting, and when you see the horizontal plane, the anterior end should be slightly below as compared to the posterior end, and you should hold it in the with the same hand that it belongs. So if it is a right rib, you should hold it with the right hand, and this is how you should hold it in anatomical position. One more thing, when you see the vertebra and connected rib from above, because of backward and lateral direction of the initial shaft, and then it is followed by twisting, here forms a paravertebral gutter, okay, on either side of the vertebral column because of the curvature and twisting of the ribs. Now this paravertebral gutter lodges rounded posterior border of the lungs. So that increases the anteroposterior diameter, this curvature, and that lodges posterior border of the lung. So this is regarding general features, attachments, site determination, and anatomical position of typical ribs. Hope you have understood well. Thanks for watching.